Good afternoon. My name is Sarah Johnson, and today I'm going to be talking with you about nurse burnout, how important it is that we as nursing leadership recognize it, and how we can prevent it. The role of the nurse has changed dramatically over the years. Nurses are no longer viewed as those whose role is to simply pass medications in empty bedpans. With the introductions of new technology and increasing government regulation, including electronic medical records, nurses are spending more and more time with burdensome regulations and documentations and less time with patient care. Nursing burnout is among the leading patient safety and quality concerns in healthcare organizations today. A few areas that I would like to address with you today are the main factors that contribute to burnout, burnout statistics, recognizing the signs of burnout, different methods for addressing burnout, and in the end, finding the right balance. Let's start by discussing some of the main factors that contribute to burnout. Here's just a few of them. Increased demands by employers. When I think of this kind of demand, I think of things such as patient satisfaction surveys. I know a lot of businesses today will hand out surveys to their customers, and I think it's very important. But I also know that in our business and healthcare, that when we hand out these patient satisfaction surveys, it puts an added stressor on the nurse because they know full well that they're tied to reimbursement, they're possibly tied to a bonus. So again, this is just an added stressor. Some other areas that could lead to burnout, some other factors could be decreased staffing, long hours. Some nurses work up to 18 hours in a shift. Things such as high stress situations. And here I think of our emergency department staff. They're dealing with critical patients each and every day. Not only the patients, but they're dealing with their families. And another area or factor that could lead to burnout could be the demanding and abusive patients that we deal with on almost a daily basis anymore. There was a study done in 2019 of 2,000 healthcare partners, and it was found that, the slide is going to be hard for you to see. It was found that 15.6% of all nurses reported feelings of burnout. It reported that emergency room nurses are at highest risk of burnout. 5% of the respondents said that their organization was highly effective at helping staff address burnout. 39% said that their organization was slightly effective at helping staff address burnout. And 56% said that their organization was slightly ineffective or highly ineffective at helping staff address burnout. That's a pretty high rate of employees who felt like their organization was not quite ready or effective at helping them address the burnout. Recognizing the signs of burnout. What does burnout look like? Well, just a few things. A few signs that you could look for would be feeling depressed or tired during your shift, no longer enjoying getting to know the patients and their families. That's what we go into nursing for. We want to get to know our patients. We want to get to know their families. And if you're not feeling that anymore, that definitely could be a sign of burnout. Showing up to work just to get a paycheck. If you're not there to give good care, you're only there to collect the paycheck, that's definitely a sign of burnout. Feeling irritable, that's a sign. Methods for addressing the burnout. Open communication. This is so important. We have to talk to our nurses. We have to understand what they're dealing with. We have to listen to them. We have to work with staff to improve processes, include them in solutions if we can. We have to celebrate wins. This here is a picture of some of the staff that I work with in the emergency department at our hospital. I work at Helen Newberry Joy Hospital here in Newberry, Michigan. And I just wanted to list a couple of the things that we do at Helen Joy to help prevent burnout. The top here, open communication. We just talked about that. So important that I listen to them. I hear them as the director of nursing. I have an open door policy. I want them to come in and talk to me. We can talk through things, and I can be open to their ideas and their concerns. Team building. If you see in this picture, we're doing a team building project. This actually happened to be a gingerbread house contest. Every department at our hospital participated in this project. And these projects are good because they allow for the staff to get together and talk about one another, talk about their families. It's a less stressful situation, obviously. It allows them to know a little bit more about each other. Some other things that we do, we have a wellness center that's available to our employees. I know a lot of people find that exercise will help to reduce their stress and their anxiety, so this is available. We have an employee assistance program should they need it. And we also have a business called Weber Endeavors, and this offers counseling for the staff should they need that for any situation. Lastly, and in conclusion, I just want to mention that nursing leadership and upper management must be cognizant of the signs of nurses experiencing burnout. We also have to be aware that there are going to be unusual circumstances, such as the current pandemic, this COVID-19. This creates serious concern for our nurses that lends itself to create stress and increase burnout. We want to be there for our employees. We have to intervene. We have to help them. Leadership needs to do everything in their power to prevent nurses from leaving the profession. Thank you.